In this video, we're going to be demonstrating the auscultation of breath sounds. The objective is to demonstrate the ability to locate positions at which to listen for breath sounds. For the OEC, the point of doing this skill is to determine if air is moving in and out and if your patient is sufficiently oxygenated. The first steps that Zach would take is initiating his standard precautions. He has his gloves on, and he would obtain permission from the victim, in this case Sabrina. He would warm up his stethoscope, and then start in the right front side, the anterior side. He'll place the stethoscope on the right side of the anterior chest, 1 to 1.5 inches below the middle of the clavicle, which is the second intercostal space.
Take it deeper.
Next, you'll listen to the upper left anterior lobe on the left side of the chest, 1 to 1.5 inches below the middle of the clavicle. Then the right lower lobe, placing the stethoscope on the right side of the chest, 2 inches below the nipple line. And then the left anterior lobe, placing the stethoscope on the left side, 2 inches below the nipple line. Then we're going to listen to the back, starting in the right posterior lobe, placing the stethoscope on the upper right back between the top of the scapula and the spine, 2 inches below the neck. Then moving to the left upper lobe, posterior, same position, left upper back between the top of the scapula and the spine, 2 inches below the neck. Then moving on to the right lower lobe, placing the stethoscope on the right lower back between below the bottom of the scapula. And then moving on to the left lower lobe, placing the stethoscope on the left lower back below the bottom of the scapula. After listening to all the lung fields, anterior and posterior, you verbalize what breath sounds you heard. At the OEC level, you should be noting if they are normal or abnormal. Abnormal breath sounds may be diminished, absent, noises such as crackles, wheezes, or gurgles, or unequal between right and left.